How to use the appeals process for patient rights. Imagine facing a healthcare decision that feels unfair or limiting your access to needed services. What can you do to stand up for your rights? That's where the appeals process comes in. It's a way to challenge decisions made by your health plan or medical provider. Knowing how to navigate this process can help you get the care you deserve. First, review the denial notice carefully. It explains why your claim or service was refused. It also shows the steps to file an appeal. Most appeals need to be filed within 60 days of receiving the denial. If you miss this deadline, some plans may still accept a late appeal if you were unable to act due to illness or disability. Start with the first level of appeal. You or your healthcare provider submit a written or oral request asking the insurance company to reconsider their decision. Include any new medical records or letters from your doctor that support your case. Sometimes, you can request a peer-to-peer review, where your doctor talks directly with the insurance medical reviewer to explain why the service is necessary. If the first appeal is denied, you can move to the second level. This involves asking a higher authority within the insurance company, often a medical director, to review the decision. They will check if your care meets coverage rules and whether it is considered experimental or investigational. If you still do not get a positive outcome, you can request an external or independent review. This means a third-party medical expert, not connected to your insurer, will evaluate whether the denial was justified based on medical standards. This step is especially helpful for complex cases or when your health is at risk. For certain programs like Social Security Disability or Medicaid, you may need to go to an administrative hearing or court review. These are formal settings where you can present your case, possibly with legal help. In urgent situations where waiting could harm your health, you can ask for an expedited appeal. This fast-tracked process usually responds within 24 to 72 hours, ensuring you get quick decisions when time is critical. Throughout the entire process, keep detailed records. Save copies of all documents, notes from phone calls, and deadlines. You can also seek help from patient advocates or disability rights groups. They can guide you through the steps and help you prepare your case. For patients with disabilities, the appeals process is a vital tool. It helps ensure you get inclusive, accessible care and that your rights are protected. By actively participating in appeals, you take control of your health care and push for services that meet your needs. Remember, understanding your rights and the steps to challenge decisions can make a big difference. Review your denial notices carefully, gather supporting evidence, and follow each level of appeal diligently. If needed, ask for help from advocates who know how to navigate the system. This process is your way to stand up for the care you deserve and ensure your health care is fair and inclusive.